subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors today. We are delighted to have here with us yet again Dr. Prashant Pattnaik. Dr. Prashant Pattnaik is a leading urologist and he is head of the Department of Urology at the Wockhardt Hospitals in Mumbai. After his MBBS, his MS in Surgery and in MCH in Urology from the Mumbai University, he successfully managed the first Lithotripsy center in India. He has a record number of treating more than 50,000 cases, perhaps more now, of stone and allied diseases across the country and overseas through lithotripsy and endourological procedures. He was among the first to treat stone patients with pacemakers, a recipient of several awards. He's a member of the Society International of Urology, the American Urological Association, the International Endourological Society, the European Association of Urology, and the Indian Urological Association. He is also faculty at the Mumbai Hospital. We are delighted to have you with us once again, Dr. Pattnaik. How have you been? How has the last year been? We've, COVID is of course a thing of the past, I think.
Yeah, but fortunately or unfortunately, the medical fraternity is always on the toes, and we were very busy, I tell you honestly, because we were trying to save the lives of so many people. But of course, God helps. But we took lots of measures to cure the patients, and what the calamities we've seen, probably it is unimaginable. But thanks to our patients and also the technology, and I tell you proudly, I can say that Mumbai, at least we saved most of the lives, and people who are not, the mortality rate is very, very less in Mumbai, and we achieved a complete eradication of this COVID from Mumbai.
Absolutely, hats off to the entire medical fraternity for being able to do this. But tell me something, doctor, in this entire COVID period, and especially because you are concerned with urology, did people with ailments, kidney ailments, and other concerns suffer a lot more? Because clearly the focus was on COVID, and even hospitals and the government advised that anything which is non-critical should not be given priority. So did that thing happen?
No. This is a wrong. I think probably it was mistaken. So now we had divided into two parts. One is for the COVID patients and non-COVID patients. And what we used to do, the COVID patients will be treated in a different way, and non-COVID patients will be different. So we have never neglected non-COVID patients. Even the normal, regular surgeries was carried out.
Yeah, but I'm saying that was as far as surgery, but people felt a little, worried, concerned about visiting hospitals or whatever. Did that happen at all? Did you find that post-COVID, the number of people who came in were more because they neglected themselves?
No. See, what we used to do, we started these teleconsultations. So sitting at home, and we can see the video chat, and we used to treat their ailments so that they will not be panicky to come to the doctors and travel the distance and get infected. So that part was doing very well. I tell you honestly, people were so happy sitting at their home. We could see them, we could examine them on this video consulting, and then we would treat their ailments. So it was really, nobody is neglected, and everybody was treated nicely.
Absolutely. The internet has been there in India since 1995. And the last 3 years have taken the internet technology to a different level. And here we are talking to you the second time over in the last year and a half, and it's been amazing. So, friends, we have invited Dr. Pattnaik to talk about kidney stones and kidney care for senior citizens. He has a presentation here. As always, if you have any questions for Dr. Pattnaik, please feel free to put them in the Q&A tab. Once again, mention your age and your gender so Dr. Pattnaik could give a considered reply, and we will take the questions after his 20 or 5-minute presentation. Over to you, Dr. Pattnaik.
Thank you so much. Now, welcome all of you whoever is listening to me. And today I'm going to talk about the causes, the diagnosis, treatment, and preventive part of the stone disease. So, just a minute. Now, the agenda, what is the agenda? Kidney stone or stone is not only in the kidney, but also and the track of the kidney into up to the bladder. So this is called urolithiasis. Uro means urine, urinary tract, lithiasis means stone. So this terminology is urolithiasis. Then we'll also go to the background. We will study the epidemiology and then what are the types of stones, the pathophysiology of stone formation, the risk factors, the clinical features, and what are the examinations we do, and how do you diagnose, and how do you manage. Next. So now, urolithiasis or the stone disease is it's a Greek term, which is the condition where urinary stones are formed or located anywhere in the urinary system, that is kidney, ureter, or bladder. Now, in this context of in India, I'm fortunate to treat all over the country, patients from all over the country. So out of 1,000 Indians suffer from stone disease. This is a very, very bad situation, but we cannot prevent it. However, we have got definite means to treat them, to pick them up in the early stage and treat them. More common in the stone belts are Maharashtra, Gujarat, Punjab, Haryana, Delhi, and Rajasthan, to name a few. You can see in the other right side, the stone belt areas, mainly the Rajasthan tops the list, then Haryana, Punjab, Madhya Pradesh, Maharashtra, Bihar, Gujarat, Jharkhand, West Bengal, all they follow. So now, if you see the urban area, the incidence is almost increasing now. Rural area, because what happens, you know, when with the type of diet, with the type of lifestyle in urban areas, people tend to take lots of proteins and a lot of high rich diets. That's the reason the stone incidence is increasing day by day. Now, throughout the lifetime, we have calculated that the stone is estimated at 1 to 15% with the probability of having a stone according to the age, gender, race, and geographical location. So recurrence rate is almost 10% a year. So at the end of 10 years, even if the stone is eliminated or removed, there is a chance that it will recur in 10 years' time, 100%. So there are factors for stone formation, which is one is the internal factor and external factors. Now, on the right side, you can see there you can see the kidney and the top, and ureter is the tube which joins the kidney to the bladder. Now, from there, you know, in male there is a prostate, and in female there is a female urethra. So all this is the thing. Anywhere the stone can form in the entire tract, so that you know, when it's the kidney, we call it kidney stone. When it's in the ureter or the pipe, we call it ureteral stone. When it's the urinary bladder, we call it bladder stone. And when it's the urethra, we call it urethral stone. So now, what are the types of stones? Then the stones, for your knowledge, I have divided into four types. One is calcium stone, struvite or infective stones, uric acid stones, and cystine stones. These are the broad classification. Now, according to the population, around 75 to 80% of the senior citizens will form calcium oxalate stones, and why the urine becomes acidic or alkaline, accordingly they can form stones. The other stones are uric acid stones. When lot of non-veg or lot of what you call the seafoods are taken, then you form this uric acid stones. Especially in coastal areas, people are prone for these uric acid stones. And the struvite or the infective stones, because of the infection in kidney for various reasons. Yeah. Yes. Now, again, the calcium stones you can see on the left side. Uric acid stones, the color is yellow, and infective stones are pale white, and cystine stones are ground glass appearance. Now, what are the pathophysiology? The formation of stone is a complex process and it's difficult for me to explain in simple language. But what happens once there is a infection or there is some crystal formation because of the stasis of the urine in any urinary tract system, then the concentration increases and there the crystals they surface out. These crystals, because there is a change in the urinary pH or urinary flow is restricted because of the enlarged prostate, they try to remain inside the urinary tract and then they form stones. Remember, this is a vicious circle. The stone once it's formed, it can be because of infection or infection can cause stone. Then there is a stasis of the urine which can form stone and which can create infection. So this is circle. So not only we treat the stone, but also you have to treat the infection and also any obstruction is there in the passage of the urine, you have to correct them. Now, if the water intake is less, then there is a chance of stone formation. If there is a pH is low, then also there is a high chances. If it's static urine, there is no way to completely evacuate the urine because of the obstruction also, then there is a stone formation. Infection due to any bacteria, there also can cause stone formation. If it is concentration, also the stone form on the, and if you dilute it, it will not form. Next. Now, at the age of 40 and above, normally type of stones changes, and below 40 years, the type of stone changes. But if the stone occurs at the later age, they are almost very hard, and also they can damage the kidney. And they can create hypertension, the high blood pressure, also diabetes. All those things are dangerous proposition for the kidney, and stone disease along with that becomes a very difficult situation. Male suffer more than the female, and strong family history of stone formation. If the parents or grandparents or the forefathers have stone, then also there is a chance that it might skip few generations, but it will reappear again. The Caucasians have got the maximum stone formation. Positive family history, as I mentioned. Obesity and diabetes, high blood pressure also, these patients have got tendency to form stone. Those who take high amount of animal protein, they also can form stones. Then high salt intake also, I always tell them to reduce the salt intake because the sodium in the salt is one of the culprits. And we have to increase the vitamin D intake, vitamin C intake, and sedentary lifestyle one is to avoid because the senior citizens are, mostly they are confined to a place. I would always tell them that encourage them to move as much as possible, engage yourself in physical activities, and throughout day and day, you should work somewhere. You can walk, you can do any exercises, anything, but don't have a sedentary lifestyle. And fluid intake should be so much that your urine output should be more than 1 liter. Now, what are the risk factors? The family history, age, and gender, as I mentioned already, and occupation, those who work in hot climate or in chemical factories or in places where there is lot of sweating occurs and temperature rises, there is the risk of stone formation is there. Now, what is how they present? Once the stone forms, the presentation is quite variable. They may come with main thing that can come with excruciating pain, or due to infection and septicemia, where there might be blood in the urine, or they may not have any symptoms. But the stone grows slowly in size and it damages the kidney. They are the worst persons. Now the colicky pain, it starts from behind. If you get a back pain, always suspect that there might be a stone formation. And there will be some kind of blood in the urine, and nausea and vomiting also associated with almost 50% of the cases. Now, the big stones, they grow silently. Many times the person doesn't know also that he is having a stone. It grows inside to such an extent that it damages the kidney and they come with kidney failure. So periodic checkup is always necessary. One should do at least 6 month wise or year wise one ultrasound or one X-ray to find out whether he is having stone or not. This is mandatory. As you go for health checkup, you must do that. Once we see this, then we do the X-ray studies and we inject the contrast and take the pictures, and that tell us about the level of the stone, where it is situated, how much damage is it caused to the kidney, and we can take a call whether to start with medical treatment or to do a surgery. Now, once there is a stone obstructed in the system, in the pipe, then the kidney becomes swollen and it can damage, in the subsequently we will get non-functioning or damaged kidneys. Now, in the ureteral stone, when they come with acute pain, so much so that it is very difficult to control that pain. We have to give intravenous injections and admit them in the hospital to manage their pain. And with they also come with severe vomiting, nausea, and sometimes in septicemia, that is septic. So then you can see the stone at the junction of the bladder. So that slowly and slowly they damage the kidney. So then the patient develop frequency of urine, try to pass urine every 5 minutes, 10 minutes, getting up in the night. Many times we think that is a prostate, but maybe because of the stone in the lower urinary tract can also present like this. So we have to be very careful in knowing your symptoms and meet the urologist so that they can examine and they can find out the exact location of the stone and it can be treated immediately. Then what are the laboratory tests we do? We do the complete blood count, we do serum electrolyte and also urine tests and the X-rays and ultrasound. Now, if there is a emergency pain, then we give the painkillers and also we do a urine culture study and we put them on antibiotics. So now, once we dictate the stone and we think that with medical management it doesn't go or it is deterrent to the kidney, then we have surgical options. Surgical options are to release the obstruction by putting a stent in the system, or we puncture the kidney and put a tube so that the urine will be diverted. And there are definitive treatment are there, like ESWL, which I have started in this country first time. So this is the thing, without any surgery, the patient sleeps on the table and then we break them with the laser waves and they break them and the stones pass out in small pieces out of the blood. This is called lithotripsy or ESWL. The patient can walk home immediately and they can then patient will be discharged the same day, no cutting, no surgery, and patients can resume their work or normal activities from the next day. So it is quite safe, but there are certain indications. This is the machine which is there on the left side. You can see patient sleeps on the table and the shock waves, they start from either front or back, and then it is without any anesthesia, without any injections, and the patient walk home immediately after treatment. So benefits of the ESWL or the shockwave therapy is completely non-invasive, day-care procedure, doesn't require anesthesia, and we can treat any stone like kidney stone, ureteric stone, bladder stone. In case of even pancreatic stones, in case of gallbladder stones, everything can be treated by this machine. This is a wonder machine which is really beneficial and boon for the society. Now you can see this live picture. I am breaking the stone with the ultrasound guidance. You can see the fragments going and patient is sleeping on the table and the stone is getting fragmented. Next. Similarly, you can see the stone anywhere in the system. Such a big stone I am breaking and it becomes powder and it passes in the urine. Next. Same thing. Near the bladder also I can treat and the stone gets pulverized powder and it comes out. So this is a boon for the society. Then patients goes on immediately after maybe 1 hour and we call them for follow-up after 1 week. And once we see that everything is gone, we put them on antibiotics and also preventive measures. This is the bladder stone. We can treat in the bladder also, and then you can see the fermentation, they become powder and they pass out in the urine. Now, if it's the ureter and the stuck, then we have got small telescopes with that instrument. We pass through the natural places and we go into the direct of the stone and we break them with laser. This we call as retrograde intravenous surgery. This is we admit the patient for a day or two and we send them home after 2 days. This to treat the ureteric stone. Now, when there is a big stone in the kidney, we put a needle from behind, and with this small telescope, we go there, we break the stones and crush them out. So on the right side, you can see smaller equipments for even the small, even in big stones, we apply this very thin needle kind of thing through that laser fiber goes, and we break the stone, and patient can go home on the next day. Now, coming to the preventive part, you must drink plenty of water. Even if you don't have stone, drink water throughout the day, and then add fresh lemon juice to your water. Eat more calcium-rich food. Eat less sodium. Choose a diet that is low in salt and animal protein. Eat fewer auxiliary rich food, and avoid vitamin C. Auxiliary rich food is the brinjal, tomato, ladies finger, like the red meat, like that. And add vitamin C supplements. Avoid this soft drinks, fizzy drinks, and use caution with calcium supplements, because a lot of people think that my bones will become strong and I take calcium, but without consulting the doctors, you should not start calcium. And use caution the dehydration, and you drink plenty of water, and excessive sweating also you should avoid. Maintaining a healthy weight is very important. I don't recommend that you should do vigorous exercise, but your weight should be within under control. So these are hacks and these are the avoids. You can go to this chart. I have given them in picture form, and you should have all these things. You should avoid the below things. Thank you very much for your patience here. Thank you.
Thank you very much, Doctor, for a very detailed presentation. And once again, most of the answers that people would have questions for have been asked, but I will still, read out all the questions that have been asked.
Yeah. So now the question is that, my relation was having a stone in ureteric junction, and he took beer and stone washed out. And
so I'll ask the question. I'll ask the questions because there are quite a few repeat questions.
Yeah.
So I'll ask the questions. Can I request your team person to disable the screen share?
Stop. Okay. All
right. Thank you. So yes. So the first question is from Mr. S.L. Jain, who says my relation was having stone at the ureteric junction, and he took beer and the stone washed out. And another person was advised laser stab with success. Your advice and opinion?
Yeah, good question. My answer to this that beer is not at all indicated. This is a myth, and the stone passed out is lucky, but beer itself can cause stone because beer contains oxalate. And oxalate, when it combined in the body with calcium, it forms stone. So I would not advise beer today, and one should only drink plain God-given water. That is the best flushing solution available in the world. So do not ever think of taking beer. That is my advice. And Lasix, without the urologist permission or doctor's permission, one should not take Lasix, because Lasix can cause severe drop in blood pressure sometimes, and patient and also the sodium will fall. So it is very dangerous without advice of the doctor.
Right. Doctor, you have answered a few of these questions, but I'll just say, in case you have any additional point, my name is Jitendra Shah. He's aged 66 years. He's a regular he needs to visit the urinal regularly at night, and does it indicate any disease, and if yes, how to cure and take remedial steps for prevention? We have another question from Mr. Bharat Mehta, who's also 66. His question is, what is nocturia? At this age, I have to go 4 to 5 times a night for urination. What precautions should a senior citizen take? Another question from Mr. Narendra Shah, who says he's 70 and his ask is, what is the reason for frequent urination? So a lot of questions which are around frequent urination. So apart from what you've already said in the presentation, by the way, to all the people over here, Dr. Pattnaik's presentation and this entire session, the edited extracts, edited video will be there on seniorstoday.in on Monday the 28th, sometime in the second half. It will be there on the website, so you can visit it. If you missed out on some of the finer points, if you were not taking, you were not very sure, you may have missed out on something because of the doorbell or whatever, you can watch the entire presentation once again and get something out. But Doctor, your response.
Yeah. See, now of course, the question which has been asked about the urinary frequency. So now the frequent urination, maybe there's several reasons. It might be some blockage in the passage, number one, or maybe because of the prostatic enlargement. So one has to get himself examined by taking an ultrasound and meet the urologist so that they will examine and find out the reason. Many times with medications, with small medicines, patient can be all right. No need of going into surgeries now in majority of cases. However, after proper investigations and only we can advise something.
Right. Thank you, Doctor. Doctor, we have a question from Mr. Brick Kalia, who says, I'm 77, diabetic, creatinine level is 1.3, 1.4. Can you suggest a proper diet for CKD patients to prevent further damage to the kidneys? Something like do's and don'ts. Is there something that you could advise in a short?
The CKD patients, they have the main, first and foremost, is that they should not drink more water. The entire water intake should not be more than 1.5 to 2 liters in 24 hours. So I would always ask them to keep in a bottle about 1.5 liters and drink only from that so that they can calculate and drink, number one. Number two, avoid all those pulses and what you call the non-veg should be restricted, almost eliminated. And in vegetables and fruits and contains a lot of potassium. So only one fruit is allowed per day, and the rich diet, so protein diet should be avoided. Milk, you can take only half glass, and in fact, pulses, dal and all, you can take only 1/4 of the vati. So if you maintain like this, and if you maintain your fluid intake less, and then sedentary work, here one should take rest as far as possible and do not involve in vigorous exercises. And I would always advise the sedentary lifestyle for CKD patients. And then monitor the creatinine from time to time. If it increases, then you have to consult the urologist.
Right. Just for the benefit of people here, CKD is chronic kidney disease. We have a question from Mr. Kadanchaya Rao. Well, this is a question from Mr. Brahmanand Rao, who's 73. My PSA rates ranged from 1.1 to 1.69 between 2016 and 2020, but it has shot up to 3.42 in August 2022. It was 4.35 in Jan 2022. He asks for advice.
So now here, when the PSA there's an increase, then he has to do the ratio 3:, total by this ratio is there. He has to undergo that test, number one. Then also
one type of
yeah.
Two different types.
So there are different types of PSA in the body. So one is to do the ratio study, number one. Number two, he should go for an MRI of the prostate. That is MRI of the prostate. That will tell us multi-parametric MRI. So that will tell us about the scoring and all, and then we can decide. Then we can decide which category he falls. Accordingly, we can treat them.
Right. Thank you, doctor. We have a question from Mr. K. Lakshminayan, who says he's 67. He consumes a fair amount of dry nuts with salads as his main meal twice a day. I drink a lot of water for many years and I don't get up at night at all. What is the estimated cost of a laser surgery? He asks.
For what? Laser surgery for what?
Yeah, that's what I don't know, because he seems to be.
First of all, he's on a keto diet which has to be avoided. Nuts with salad is a keto diet.
See, this salads and all what he takes is nuts and salad. It's a keto diet, so he has to avoid that thing. Number one. Number two, number two is that he has to increase his water intake, and the cost of the laser treatment varies, depends on the size of the stone, location of the stone. It is quite affordable. It's quite now the days are gone that expensive and all. It's quite affordable, and he can consult across the table we can do the things.
Are these laser surgeries covered by medical insurance?
Yes, 100%. 100% is
Are covered by medical insurance. So that's it. Doctor, we have a question from Jayanti S. She writes, my husband is 74, had creatinine of 1.7 in Feb 2022. In November, he had high BP of 200 by 90. Some BP medicines were changed. A test after 10 days revealed creatinine as 4. Had breathing issues as CP edema. A nephrologist changed the Amlong A to Amlong, stopped metformin to Glyme, gave Cudofort and Sohen's tab for 15 days with salt-free diet and 1 liter of liquid a day. Then the test showed creatinine as 3. So same medication advised for 1 more month with very less salt.
Right.
Is creatinine reversible? She asks. Any advice on food and fruits? While taking so many medicines, water is needed to flush out toxins. Now the 1 liter liquid, is it sufficient?
Yes.
She says she is worried.
Yes, 1 liter is sufficient, because if you take more water, then he will develop more swelling, number one. And kidneys are not that powerful to take care of more water in these cases. And so that is absolutely right treatment. However, he has to control his blood pressure and constant visit to the nephrologist, so that it can be reversed, but it will not come down to the basic level. However,
Right.
even it comes down and it's a downward trend, I'm quite happy and nothing is going to happen if he maintains the protocol and guidelines which has been given by the nephrologist. But blood pressure should be under control. That's all.
Right. We have a question from Mr. K. Suranayan. It's a rather long question, but I'll just say it. He is male 70. It says, due to difficulty in passing urine, he consulted a urologist near to his house. He recommended scanning, and scanning result, his right kidney measures 11.1 by 4 and left measures 10.4 by 4.1. Left kidney shows mild fullness and pelvic cervical system. Prostate is 4.3 into 3.9 into 4.8. And the weight is 43 cms. He also suggested to have blood test after taking Sildu 8 mg 10 days, and blood test PSA is 2.3. Now, since the doctor was not available after 10 days, he consulted a physician who asked me to take the same medicine. Now I'm due to visit the doctor next week, and he gets pain sometimes on the lower back, which is bearable. His question is, please suggest what precautions should I take? Before you answer this question, doctors, I must advise all our viewers here that while you do mention medicines, etc., and the doctor is here to give you all the advice, but there's nothing like meeting a doctor face to face and seeking advice. Those of you who would like to consult with Dr. Pattnaik, you can also do that at Wockhardt Hospitals or his clinic, which is in the western suburbs of Mumbai. Doctor, your response to him about what advice, what should he do for taking precautions?
Yes. Now coming back to his symptoms, there is little enlargement of the kidneys by both sides, which is not alarming. So he should not have any fear for that. But however, he has a prostatic enlargement, which can be well managed by medical line of treatment. Whatever treatment he's taking is absolutely fine. You should maintain that thing, but He has to continue the medicine as long as he takes the medicines for relieving the prostatic symptoms. Nothing is going to happen. And without consulting the urologist, he should not stop medicines. I think 80% of patients I've seen with medicines, they don't require surgery. So it is a very good thing. He can manage that. And I don't think any immediate danger for him. That's all.
Right. Thank you very much, Doctor, for your time taken over here and a very detailed presentation. There are a few questions that have come in, but most of the answers you've already given given over here. There's one more question which has come in. Is it better to drink small quantities of water frequently or large quantities of water infrequently? It's an interesting question which I thought I must ask.
So this is a very, very, very nice question. So that's the reason always I tell my patients or the persons who come to consult me that, you have to take at frequent intervals. Do not consume too much of water at one time. That will put a lot of pressure on the kidney. So I always tell 200 ml every hour to 2 hours. That's all. That is the thing. By the end of the day, your body will be hydrated properly. It will not have a lot of load on the kidney. So 200 ml, 1 to 2 hours interval.
And does this amount of water include all liquids, which means tea or coffee?
No, apart from the liquids and all. This is the water intake I'm talking. Water.
This is the water intake. And one question, Doctor, this is from SL Jain. Lithotripsy by crushing stone. What is your opinion?
That I've shown in my diagram, in my video also.
Right. So you can see that.
Yeah.
And that's about it. Doctor, it was great to have you here. And once again, very detailed presentation. That is the question to have, the ask to have a session on kidney stones was huge from our readers. So it was very good. As always, we will be there with Health Live webinars every week, every Saturday at 5 p.m. Those of you who would like to attend these and do not want to wait for the announcement to come in, please register. Please pre-register, and the form is there in the chat window. You can fill up the form, and we will send you an invitation to all our sessions that we hold. We will be doing something next week, next Saturday, that is December 3rd at 5 p.m. Thank you very much once again, Dr. Pattnaik, for your session, and it was a pleasure to have you here with us once again. Thank you.
Thank you so much. Thank you so much. Thank you very much. Thank you.
Subscribe now and press the bell icon. Never miss an update.